I'm going to introduce my friend, Dr. Simon Yu, who I would like to preface by saying a doctor has become a very valuable doctor for me personally. I practice in Massachusetts, and I have sent many patients to Dr. Yu. They get in a plane and they fly to St. Louis. That's how valuable his service is. He is really excellent at diagnosing those cases where you can't figure out what is wrong. No one can figure out is wrong. So I'm going to personally give you advice, take down his information. Dr. Simon Yu practices internal medicine and alternative complementary medicine in St. Louis, Missouri. He's a graduate of Washington University in St. Louis, and he has master's degrees for his research on virology and immunology, on influenza virus and cell-mediated immunology. He served in the U.S. Army Reserve for 25 years and retired in 2005 as a full colonel. He was deployed in Bolivia for a military peacekeeping mission, I love you for that, in 2001, where he had a unique experience treating parasite problems in South America, which led to treating successfully some of the most complex and difficult patients. He has published numerous articles in the St. Louis Health newspaper on controversial medical topics, lectured on similar topics, and published a book, Accidental Cure, which is excellent, in 2010. I give you the man.
Thank you, Mark. Yeah. Well, thank you for invitation to IAOMT and IABDM. For the next 60 minutes, I'll be talking about dental, parasite, and energy medicine as a missing link for incurable. And if you see that it says accidental cure, if you got the drift. The objective for the lecture will be to recognize that parasites and dental problems are always overlooked in medical practice. There's a new way of detecting parasite and hidden dental problem by using current technology based on acupuncture meridian assessment. Prevent recurrent parasite infections and parasite-related dental problems, and understanding the incurable dental medical parasite complex problems, and evidence-based case studies I'll be talking to you throughout the next 60 minutes. And you as a dentist may play a very important role for anti-aging medicine. 2005, JAMA published the medical care become the third leading cause of death. Over 225,000 people died from medical care. That same year at 2005, Journal of Automolecular Medicine published that 783,000 deaths caused by iatrogenic medical care at a cost of $280 billion for the #1 leading cause of deaths in USA. So you can pick and choose a number, either #1 killer or #3 killer is caused by medical care. Now, we're talking about energy, medicine, and dentistry. Treating human without the concept of energy is treating dead matter. Body chemistry is governed by quantum cellular fields. The energy field starts a role. So 1 out of 2 men and 1 out of 3 women develop cancer during their lifetime. And the question is there a role for energy medicine in dentistry? Professor William Tiller talks about future of the medicine will be based on controlling energy in the body. To be able to control the energy in the body, we have to measure the energy field, the subtle energy field beyond X-rays, beyond cone beam, beyond cavitate, and whatever the blood tests we do. And we're looking at energy medicine and dentistry as a whole biological system, And my focus will be on Meridians as a biocybernetics and matrix system, as a bioinformation, and to tap into innate intelligence of our immune system to heal ourselves. So let's get into basic physics. We have a Newtonian mechanics, universal gravitation, force, and acceleration. And I want to go beyond looking at our body as a battery pack, or capacitor, or circuit breaker. But at the end of my lecture, my conclusion will be the same as Dr. Tennant. I want to go beyond battery packet as a meridian system. So if you go into special relativity, we're talking about space, time, geometry, quantum mechanics, wave-particle duality. All these fields are moving into quantum field theory with virtual particles, general relativity with a dynamic space-time. These fields are merging into what I call quantum field theory with general relativity. When you get into this field, time does not matter anymore. We're going into virtual reality. So let's go back to 2,000 years from now. 2,000 years ago, there's a Jesus holding the bread and the fish. It says, I cannot eat that, I'm a vegan. Has the fish has been tested for mercury? Is that bread gluten-free? This is what I call virtual global whining. But nothing changed. We always complain and whine. And some of us are so picky, they're going to say, the picture is wrong because the Bible said Jesus was holding 2 fish and 5 loaves of bread, and he's got only 1 fish and 1 loaf of bread. They're bogged down with that, all those minute details, and I want you to be a little bit open-minded about the whole process for the next 55 minutes. If you go now another 2,000 years, now we talk about 4,000 years ago, ancient civilization. I'm not really sure so human was able to map this thing out. But they mapped out this matrix system called Meridian system. And if you go back another 2,000 years, we're talking about Sumerian medicine. If you go for another 2,000 years, now we're getting into Ayurvedic medicine and beyond, who knows. But let's go back about 4,000 years. The ancient civilization already mapped out this matrix system. We call that acupuncture meridian system. And if you look at it from the evolution point of view, we have a universal ancestor, and we have a archaea, the bacteria, and we have a protozoa called eukaryote. The first one is called protid. This one first have a nucleus with a DNA, and evolving into plant, animal, fungi, parasite, and human. And the parasite has been evolving at a fast rate than we can evolve. They can adapt to this toxic environment. And we have to cope with them as fast as we can. We have to recognize parasite is a real phenomenon, a real problem. Just give you an idea about this, archaea is also called Nano Bacteria. This is a new type of very small bacteria. They're abundant not just in rocks, but also in many biological specimens, including humans. Nanobacteria is everywhere, and although invisible, are probably the most dominant life form of the planet. They will easily pass through point to micron filters. Someone like a mycoplasma is formation of the kidney stones, atherosclerosis, and arthritis. This is written by geologists called dark life. If you look at it from another way, looking at the human evolutions, again, let's try again. We have a archaea, bacteria, protid, protozoa, eukaryote, evolving into plant, animal, fungi, human, and parasite. And one of the hardest parts to get rid of is what I call a hybrid of parasite and human, called human parasite. The other one works for dental board, examiners. The other medical board is the AMA. The other politicians, and whatever the pharmaceutical company. They're the true, what they call human parasite. But we're not going to get into that part. We're just focusing on parasite. And if you look at it from evolution point of view, we have to worry about the fungi and also bacteria. Bacteria is the most common dental infections. And you will see some of the fungi as a mycobacterium, like actinomycosis. And we have a protozoa, is a very common microbe as an entamoeba. And we cannot solve our problems with the same thinking we use when we create them. The secret to creativity is knowing how to hide your sources. That source is from ancient information, ancient knowledge that we have. They're at least 4,000 years old, if not 8,000 years old. Somebody mapped out all the Meridian system. Biochemical pathway alone cannot simply understand how our body functions. There's billions and billions, trillions of biochemical pathways happening within milliseconds. How do they coordinate? We have to go into understanding what we call quantum uncertainty. The classical uncertainty is flipping the coin, that head and tail. When you get into this quantum uncertainty, there is what we call interference. Now, within the interference, some of the events happen where the biochemical pathway happens for trillions of biochemical pathway, and we have to accept that intangible uncertainty with that information. This is just an example of a map of gallbladder meridian. Dr. Tennant talks about gallbladder meridian. I'm measuring from 4 toes, and if there is a disturbance, I may pick up somebody have a ankle problem, foot problem, knee problem, sciatic hip problem, backache, stiffness, indigestion, bloating, nausea, vomiting, heavy sensation through your chest, back, chest pain. They cannot figure out what's going on. They'll go to emergency room, and there's nothing wrong with you. Shoulder pain, neck pain, it will wrap your brain around because of migraine headache, concentration problem, irritabilities. It will control part of your diencephalon and mesencephalon, controlling your forebrain and your midbrain. It will wrap your ear around because of ringing in your ear, tinnitus, and it will affect your eye for eye and vision problems. All with one single meridian system. Gallbladder meridian has been mapped out 4,000 years ago. Now, I wrote in my book, one of the chapters called Death Trap. There are so many accusations that we medical doctors are killing people. So they have a guy named by Gary North talks about death by medicine. Carolyn Dean talks about death by modern medicine, death by drug companies, death by healthcare bureaucracy, death by modern medical doctors, murder by injections. And I say, wait a minute, what about those dentists? What about don't you write something about murder by dentists? Most dentists doesn't think it is funny, actually. But what I'm talking about is saved by biological and holistic dentists, people like you, to understand it. I've known Dr. Hal Huggins for about 20 years. I do organize my own conference. He came multiple times. And he's a champion of these amalgams, the danger of the amalgams, the root canals. I'm talking about implant, the danger of the implants. And he's into biochemistry, immunology, and also about DNA later in his life. And he never really chose energy medicine, checking for Meridian system. I always offer him, I will check on you, but he refused to be checked by me. But later in his life, I didn't know he was sick. I checked on him, and he's got major cavitation problem he overlooked. And I told him, you have a major cavitation. And he didn't believe me. And I told him he's got parasite problem, and he didn't believe me. And we're going to construct this, why we have to look at paras and dental play the role. And eventually he did actually cavitation work done, but it was too late. Because there's a time sequence that was important part of the healing process. The energy medicine and dentistry I learned from Doug Cook from Wisconsin. He couldn't make it at this conference because he got sick from doing, I've been told, the parasailing, and he got sick. He's only about 85 years old. He still practices. And he wrote a book called Rescued by My Dentist. That's how I got into this alternative medicine 25 years ago. And I'd like to introduce you Patrick Stockbacker from Sweden. He's an MD, PhD neurologist. I'm not sure how many people know about him. Anybody know? Okay, some of you do. Great. He wrote one of the most boring topics. It's called Dental Caries as a Cause of Nervous Disorders. He published in 1982, and not too many people read. I got his book for 1 cent. I've been writing about him. Now you cannot get his book. It's become a rare book. And he talks about golden mausoleum of crowns. The golden crowns is a golden mausoleum. It doesn't have to be just a gold crowns. It can be amalgams. It can be titanium. It can be zirconium. He talks about cranio-vertebral venous system, which I will elaborate a little bit later on. Basically, they do not have valve. There's a connection between your jaw to the brain. The entire vertebral system to your pelvic area is totally interconnected without valve. It's a great way to transmit infections. And he talks about those trigeminal nerve, retrograde axonal transport, vagus nerve, hypoglossal 12 cranial nerve that control your muscle of your tongue. So many dental patients have also movement of the tongue. And biotoxins, mycotoxins, volatile organic compound, especially polycyclic hydrocarbon or benzene-like phenolic like compound. They are all carcinogenic and neurotoxic. They are nephrotoxic, cardiotoxic, hepatotoxic. They are toxic for entire your immune system. And what are those risk factors and interference? Our body has a capacity to heal, but there are so many interference. And diet and nutrition are the basic foundation. But if you have a parasite problem, or if you have a dental problem, it doesn't matter whether you get the finest food, organic food, you're not going to get well. So my lecture will be mainly focused on parasite and hidden dental problem. Among the all unsuspected dental medical complex problems, you all know about amalgams and root canals, galvanic currents and cavitations, but a lot of what we think is a TMJ might be actually parasite problem. So when those patients with a TMJ does not respond, you have to correct the bite over and over. They may have a parasite problem. That's why they're grounding and have a bruxism. So you have to think about working together with a physician who understands this concept of the parasite problem. And pleomorphism of bacteria and protozoa. One of the most common protozoa is the entamoeba. They're part of our living system. And they create so many unexplainable medical problems. And we think it's a medical problem, but it's actually dental-related medical problems. So cause of inflammation, most of them are what we call silent inflammation. Infection from dental and gut, fungus, bacteria, virus, and parasite. Environmental toxins, heavy metals and endotoxins, allergens of food, GMOs, molds, airborne, and chemicals. Diet from high fructose, corn fructose, dysregulation of the insulin and hydrogenated rancid oil. Diet from starvation, overeating, or extreme diet can also cause inflammation. Obesity, stress, overexercise, as much as lack of exercise. I see time to time people are simply doing way too much exercise, and all that medication, chemo, radiation, smoking, and vaccination. You're all familiar with the cavitation. That cavitation probably you can see from the X-ray, just plain scan, X-ray. But most of the time, The cavitation is so small you will not see it, not even in cone beam 3D CT scan. Here's a patient come to see me with a blood pressure over 250 over 150. This patient have to go to emergency room. When I check all that Meridian system, only thing I'm picking up is a dental problem. And I checked those, like what Dr. Tennant is, who check different points, go inside checking all those dental tools. And I found there is a problem at number 17 at retromolar space X. I sent to oral surgeon, and next day blood pressure is a 140 over 85. I didn't draw that line there. There's an oral surgeon who went in and drew the diagram for me. That's what he got in. Will not show in the X-ray. You can do muscle tests, or I can do what called acupuncture meridian assessment. So let's go to Patrick Stodbacker. In his book, he talks about they did an experiment in 1920s in France and in America. You see infecting this herpes simplex virus in the eye. It wasn't actually a human eye, it wasn't a rabbit, but they just superimposed it as a human. And they measured how fast this virus will retrograde through the retrograde external transport. And it will travel at approximately 2 millimeters per hour, takes about 48 millimeters, or about 5 centimeters per day. And they will go through the ciliary ganglion, trigeminal ganglion, going to the brainstem. The distance between the ophthalmic trigeminal nerve to the brainstem is about 10-12 centimeters, depends on the size of the head. They also did on heavy metals, the lead and mercury. They move a little bit slow, but they move at about 10 millimeters per day to travel the heavy metals through the retrograde external transport. And he was pointing out about this venous system, the jaw and the cranium with the brain and all those things through the vertebral vein do not have valve all the way down to the pelvic area, to the prostate, or to the ovary. So whatever is going on in your jaw, now if you can tilt that your head as you're lying down, if you have an infection down here in your number 17 or number 16, it will travel retrograde through the vein. There is no valve to protect them from microorganisms to travel. It will go to the either brain, through the brainstem, or going down through the vertebral vein. It can go through the prostate and to the ovary. It's called emissary cranial valveless veins. Normal vein has a valve, but these are protective mechanism for increasing cranial pressure. They can diffuse the pressure. So they will go into spread the entire system called cranial valveless veins. And also there's a connection between that dental, trigeminal, and vagus alliance, and also called growth of hypogrowth as a cranial of 12. You can see the trigeminal nerve and the vagus nerve is so close to each other. They will transmit information and spread those toxins, have this not only trigeminal, it can affect you also part of your brain, but also can affect your vagus system. And vagus is considered the longest wandering cranial nerves. So if you have a cavitation between your head and your gut, all those root canals and implants, that can affect your brain, it can affect your GI tract. So crucially important part, not only through this retrograde external transport, but also from cranial vertebral valveless vein system. Are you all familiar with this valveless cranial vein vertebral system? You have to know this information. It's so important part of understanding the connection between dental and medical connection. So I do acupuncture meridian assessment curing the incurable by measuring this invisible energy field. In old days, they call it EAB, electroacupuncture, according to Dr. Verl. But they told everybody, including non-medical professional people, and they become a bad name. And anyway, so a lot of these EAB practitioners also watch me what I do, and they say, "You're not doing EAB." Because I'm doing too simple. I get to the point in 5 minutes, I know what the problem is most of the time. But keep telling me I'm not doing EAB. You're supposed to spend 2 hours and 3 hours to sort out what's going on. And usually I can figure out in 5, at the most in 10 minutes. So I decided to call it Acupuncture Meridian Assessment, AMA. You got the drip? Yeah? Nobody's laughing here? Anyway, so here's a 66-year-old man with a new onset of atrial fibrillation, echo showing upper atrial fibrillations. They did electrocardioversion, recurrent atrial fibrillation, and recommend cardiac ablation. But when I saw him, only thing I see is again dental problem. And when I check all those tooth, his implant was fine, but it was impacted wisdom tooth. Sent to the oral surgeon, looks at normal looking number 17, and his atrial fibrillation simply disappeared, never came back. But we have to connect that dot. I cannot extract that tooth. I need a dentist or oral surgeon to do it. Here's a 47-year-old Russian lady with a headache, chronic sinusitis, nosebleed, leg tremors, what I call your nightmare patient with 10 root canals and 7 implants. This is not a medical problem. This is a dental-related medical problem. I sent to the dentist, and usually they get well. She probably had to wear partial denture or almost a full denture. Here's another case here. 32-year-old man, the new diagnosis of multiple sclerosis. He's got 14 amalgams, and chief complaint, notice 1 month history of double vision, poor coordination, extreme fatigue, body ache, shortness of breath. Patient was in major hospital in St. Louis, and MRI was consistent with the brain lesion for MS. And patient was admitted and treated with a steroid. Physical exam showing 14 amalgams and several root canals. You know what you're going to do? He had actually an appointment to see biological dentist, and he told me it will cost him about $25,000 to do it. He had to borrow money from his family. And when I checked for his meridian system, his major disturbances coming from gallbladder meridian, allergy, and central nervous system. Reading is in 20s, and normal should be at 50, and normal range at 45 to 55. And I told him, before you do dental work, let me just take care of your parasite problem, and then get the dental work to be done. Usually people respond better, dental infection heal fast when you get all the parasites out of the way. Meanwhile, he had a second opinion with a major teaching hospital, and he looked pretty good, so they decided to have another MRI, and the brain lesion completely disappeared. And only thing I did for him was put him on ivermectin and metronidazole for 30 days. He only took about 10 days because he said he liked to drink beer and it makes him sick when he's taking metronidazole. So he only took 10 days of metronidazole and ivermectin. Now, I told him when he got better, now this is the time for you to get the dental work to be done. And guess what? He said, wait a minute, I don't have MS anymore. So he didn't go, he canceled the dental appointment. And I didn't see him back. And then 3 years later, he came back again with a new diagnosis. This time he got diagnosed with Lyme's. But he wasn't really interested in getting well for Lyme's. He was interested in getting disabilities so he can get that disability benefit. You know, once they're in the States, they were not going to get well. They're not going to spend $25,000 to get well. Anyway, so the comment is many neurological conditions are caused by parasite, heavy metals, and dental problem. Also needs to be differentiated by acupuncture meridian assessment. So here's a Lyme. At least 50% of the patients, what I think is a Lyme, are not Lyme at all. They're what I call pseudo-Lyme, often by dental infections, the spirochete infections. There's a Borrelia burgdorferi, because of classic Lyme, and there's a syphilis, Treponema pallidum, and then there's a whole list of this periodontal causing infection caused by this called Treponema, different subspecies of dental infections. They cross-react, looks like just like a Lyme. So when I see this, what we call Lyme patients, at least 50% of people I see have actually dental problem. In fact, one of the classic cases I've seen was a patient from Arkansas, the husband and wife have a diagnosis of seronegative Lymes, went to Germany, to Lyme clinic, felt a little bit better with all the special high-tech therapy they have. And the husband have a seropositive, but totally asymptomatic. But the difference between husband and wife is the wife have 6 root canals. It's a root canal, and we're treating for as a Lyme. Here's another case here. Maria engaged in planning to get married in June. Chief complaint, depression, anxiety, panic attack, blurry vision, review of system. I always ask, have you seen a dentist or any trauma events in your life before you got sick? She said she got one large fillings 1 week before being hospitalized in psychiatric unit for acute depression, anxiety, and panic attack. On physical exam, she got a lot of silver fillings, otherwise unremarkable. Check for her heavy metals using DMPS provocation test. Pre-baseline was already high, normal should be below 3. After chelating agent, her level went up to 63. And in her case, I told her, remove not the whole amalgams, just the one, the last large filling you put, just remove that and see what happened. And within few days, she dramatically improved. She went back to school as a school teacher, got married. I saw her for twice. She never came back. She never finished the dental work or any chelation therapy to be done. This is a typical story. When they get better, they stop coming. And eventually she'll have another episode of some major problem. Here's a 58-year-old man with the initial symptom of left leg pain and low back pain in August of 2009. CT showing mass in 13.3 centimeter by 4.3 centimeter mass of a multiloculated solid and cystic mass to the proximal femur, osseous pattern, lytic, consistent with advanced disease with subcutaneous edema within the left eye, metastatic disease to the L4 and T9. I saw him in November of 2009. The biopsy report showing moderate to poorly differentiated non-small cell carcinoma. This is a PET scan, a large mass there, and L4 and T9 as a PET scan. I'd have to put the pin because his femur is about to be fractured. And this is what I do for all my patients. Check 40 main acupuncture meridian as a system, looking for pattern recognition. Scale is 0 to 100. Ideal score is considered 50. Normal range from 45 to 55. So green means within normal range. Blue means it's a chronic degenerative conditions. Red means there's an inflammation, more recent phenomenon. Looking at the pattern, number 1, looking at is a dental problem. The list goes on. I'm not going to spend time there. What we are measuring is a resistivity. Dr. Tennant talks about voltage. It's the same phenomenon. We're just using different language we're using. By the time people have a cancer patient, they have a low resistance and a high conductivity as a part of your problem or inflammations. And we can use as a voltage or as a resistivity. And This patient have about 23 out of 40 meridians are out of balance. Those are what I call cancerous pattern. Depends on which meridian is involved. So he's got cancer of unknown primary source, placed pin in his left leg, started on chemotherapy, and developed severe ulceration. Chemo stopped and sent him to the hospice care. Put him on ivermectin and levamisole 2 rounds, and his reading looks like that, where only 3 out of 40 meridian is out of balance. And this is a pattern I see. When I go through the parasite cleansing, then I see residual dental problem there. Here's a dental problem there. And this is an allergy, immunology point. That's what I see. Heavy metals, fungal problem, allergy problem, or any chemical exposure to it. So 6 months later, he saw orthopedic surgeon, tumor completely gone. No sign of cancer, feeling well. And I told him he had to get the dental work done. This is just a simple thermal imaging, but he's got hot spot there. He's got some thyroid problem, minor sinus problems. But guess what? When they feel better, they don't come back. And then almost all cancer patients have heavy metals. It's got high in lead, mercury, platinum from chemotherapy, and also high in tungsten. And 1 year later, I didn't see him for 1 year, tumor come back, because if you don't correct the underlying problem, tumor will always come back. At this time, the mass is in his right shoulder, correspond to his large intestinal meridian, which I'm measuring right, follow the line there. He's got also dental problems and other significant meridian systems. I put him on parasite medication, but it was too late. By the time I saw him 1 year later, it's so far advanced, he couldn't even get out of the bed, ended up dying. But he was not unhappy. He was happy because he was able to see his daughter getting married, have a sort of grandchild. And when I asked him, why didn't you come back to get a dental work to be the nutritional and chelation therapy? He says, I'm spending over $2,000 a month for the medical insurance just in case cancer will come back. But he wasn't willing to spend their money on a dentist and nutritional therapy. That's a kind of a recurrent theme. You'll hear that over and over again. So every cancer I see, there seems to have a parasite problem, dental, heavy metal, environmental toxins, and often have an unresolved emotion. This is a 5-year-old boy with a nephrotic syndrome. He fell, and a few months later, he developed this nephrotic syndrome. All those evaluations, nothing shows, but he's having this heavy proteins coming out. And when I check on meridian system, dental and kidney was out of balance. Pulled the tooth out, was normal looking by the x-ray, but pulled the tooth, and he became normal. Nephrotic syndrome went away. Here's a 55-year-old female with a coronary artery disease, with a diabetes, requesting for EDTA chelation. When I checked, she got 8 amalgams and several root canals. When I see this kind of patient, I don't do chelation. As a part of my therapy is, you need to see a dentist, get the dental work done. I measured the mercury level, very high mercury level, treat with the DMPS chelation, and then I did prone EDTA chelation and totally symptomatic. And this is what we see problem. Sometimes people come to see me, I want to do chelation, and when I see they got several root canals and periodontal problem, and they say, I can spend money on you, or you make me to go to the dentist, but I can only choose one. What do you want me to do? What would you do if you're a dentist? You're going to tell them to do the chelation and not worry about the dental? I told a lot of patients, see a dentist first and see what happens. Well, I'm going to put you on oral chelating agent. It's a 50-year-old lady with asthma, initially developed at age 46, in and out of the hospital many times. She actually died and came back resuscitated. She belonged to the society where people died and came back. And I tried every known medication and natural remedies. I could not help him. That was about 20 years ago when I just have an understanding of these dental connections. And I asked her, have you done any kind of dental work done before you got sick? And she thought about it. She said, when I was 45 years old, I had a root canal done. And then 1 year later, she developed asthma, which is very unusual to have at that late age, which turned out to be number 30, go through the lung meridian. And I told her to get that tooth out, and she didn't believe me for about a year. She still go in and out of the hospital, and one day she at the hospital, she said, I don't know what to do with myself. I don't take your advice, let's pull the tooth. I sent to the dentist I know, he said, it looks perfectly normal. I just cannot justify pulling the tooth, but I know him well enough, just go ahead and pull the tooth anyway, see what happened. And he called me later on. When he pulled the tooth, there's a rotting smell coming out, and he ended up putting on antibiotics for 3 months, and asthma went away. I cannot solve this problem without dentists. Concept of homotoxicology, root canal, and 10 years later may develop prostate cancer. Maybe you have a parasite problem and root canal, and you may develop breast cancer 10 years down the road. Concept of matrix and matrix regulation by Dr. Pissinger with the concept of biological terrain. Not just pH of your blood, saliva, and urine, but you need to check for your redox potential of your saliva, blood, urine, and resistivity and conductivity of your body fluid to see the terrain. I don't have time, so I'm not going to get into that part. All those heavy metals block these essential minerals from doing the job. And just look at from mercury, what it does to your body as a symptoms. But behind the mercury, we have this slide. This slide is from 20 years ago. Dr. Boyd Haley was giving a lectures in San Diego at the environmental medicine. And if you look at from here, the sodium potassium ATPase is the most sensitive to mercury among all those other enzymes. We're talking about voltage, the energy medicine. All those ATP production, up to 80% of the ATP production is to maintain membrane potential. And sodium potassium ATPase is using all the ATP to maintaining the membrane potentials. But when it shuts down, your voltage goes down, your conductance goes down, your resistivity goes up. And we'll see through the meridian, the reading is low. Fritz Kramer from Germany mapped out this tooth and organ meridian chart. This is what I call $1 million chart for dentists and crumbs for medical doctors who really understand this chart. Because I have to send to the dentist, I want to get the crumbs. This is $1 million chart for dentists. The problem is, if you use that chart to promote and convince your patients, they're not going to trust you. So it have to be coming from somebody else. They said, no, you need to see a dentist to taking care of this. This is what you need, a relationship. Otherwise, they think you're selling the dentistry. Here's a heart meridian, tooth number 6, 1, 16, 17, and 32. This all can map out. It takes only a few minutes to check it. So Dr. Cook used computerized electron screening, or called EDS, EAV, and finding teeth and the jaw infection not detected by X-ray. That's very important for you to understand. I know you rely more and more on 3D cone beam scan, but that's only looking for mechanical point of view, anatomical change. When we talk about toxicology, energetically, it will manifest way before it will show in a 3D CT scan. And checking the residual infection after surgical procedure is done. Because I emphasize so much on dental, I have my own Panorex in my clinic. And this is tell you all those 30 where some of them are very simple, straight, like a root canals and implants, but many of our patients have perfectly normal looking X-ray. But I do pick up dental problem. as a bite problem, as a cavitation, as a not compatible, as a conduction problem, as a galvanic current problem, will show beyond what the X-ray will show. Now, you can do a muscle test if you want, but I like to use Meridian system that's been already mapped out 4,000 years ago, and that's a more elegant way to measuring the subtle energy field. And jumping into parasite, this is a global statistic on parasite. This is straight from CDC, WHO, and from the parasite textbook called Foundational Parasitology. It says 1.5 billion people are infected by Ascaris and over 60,000 people die every year. I have no idea where they get these statistics. If you look at in the middle, it will say 200 million people are infected by flukes, schistosome, and 20 million people die per year. The malaria, about 500 million people are infected by malaria, and at least 1 to 2 million people die per year. Total 4.46 billion people are infected by parasite, a leading cause of morbidity and mortality in global scale. Many of you have a parasite problem. Many of you have a bruxism and TMJ. You may have a eat right, have a nutritional problem, thinking about parasite problem. Now, compounded with a dental problem, they're creating what I call incurable medical condition. So people always talk about, how do I get into parasite? I never have any formal training in parasite, but I was in Bolivia 2001 as a part of the U.S. Army medical officer. I was a lieutenant colonel at that time, and we had a vet, we had a dentist, and everybody got parasite medication, either mebendazole or parental palmoate. And when I went back home, we took same parasite medication. And after I came back, I've been doing this meridian testing before that. It's like the large intestinal meridian is in your index finger. So somebody with IBS, I'll check, and I'll use maybe natural parasite remedies, and people's IBS get better. But when I start using prescribed medication, people say, you know, my IBS got better, but you know what? My asthma went away. You know, my chronic fatigue and fibromyalgia went away. My sciatic pain went away. My knee pain went away. My back pain went away. Sometimes my brain lesion disappears. My tumor disappeared. Some of the stuff that I never heard of it in studying alternative medicine. So I've been writing about this whole phenomenon about parasite. So parasites are masters of deception. I'm not going to get into those pictures. One of them are military disguising. And why parasite problems are overlooked. And you can read it in your handout. I'm not going to go into all those things. But it's simply difficult to detect. The standard tests are not reliable. Maybe detect less than 5%, 10%. I don't even do the parasite test anymore using SIL test. I use Bayesian meridian testing and called bioresonance phenomenon. I treat as if my patient have a parasite problem and they have to sign 5-page consent form saying there's no proof of parasite problem, but I'm going to treat you as if you have a parasite problem based on my 30-some years of medical practice, 25 years in military experience, and all those blah, blah, and they have to sign it before they get the medication. And parasites, most of them are outside of your GI tract. That could be in your lung, it could be in your brain, it could be in your tooth as an entamoeba. All those things are outside of your GI tract. These are some of the multiple signs of a parasite. Parasites speak many languages as signs and symptoms. And again, I'm not going to go into all those things. And they're creating what I call parasites follow money. So whenever follow the money, there's an MIT scientist actually check the flow of the money, and they can predict the next epidemic problems. And probably what they're predicting was epidemic, this parasite problem. With a parasite, they come with a bacteria, fungus, and viral infections. We're spending all that money to figure out what's going on, yet we don't treat them, the true underlying cause. So diet and nutrition, one half of what we eat keeps us alive, one half of what we Americans eat keeps the doctors alive. So you have a choice which half to eat. I don't have to tell you what to eat. So this is an important slide for me to emphasize. We do have a what I call biblical David. We idolize those physically fit young David. And then here's a American David. He's about 150 pounds overweight. He's got diabetes, hypertension, coronary artery disease, arthritis, you name ED and whatever. But with a modern medical care, this American David can live 80, 85 years old, up to 90 years old with all those medications we use. Sometimes one of the hardest part is this young biblical David, what this American trying to be like so fit, they over-exercise, they put so much into cosmetic, they do dental work done, root canals and implants, and all of a sudden they drop dead or ARS and some weird neurologic problem. That's one of the hardest parts to sometimes figure out, how did that happen? This young, first sergeant looks so physically fit and he dropped dead from running. And then here's a guy, he's an ancient Chinese guy. His name is also David too. Look at this guy. He's kind of soft looking, but they idolize not being too skinny or not too fat. Don't get so fixation of being so, you have to be ripped. And you can say about maintaining health. He might be physically fit, but he can be very unhealthy if you check for the Meridian system. I think this is the last case. Florence, 86-year-old white female from Chicago, chief complaint, squamous cell carcinoma of the tongue, diagnosed in December of 1997. They have a partially resected tongue, came back. If you never correct the underlying problem, tumor will always come back. And he's got multiple fillings. And what I told him was, remove those fillings. And remove actually half of the dental work done, and 1 month later to remove the other side of the amalgams, and found out his tongue tumor actually spontaneously resolved. Most likely I can think of it as when you have a lot of fillings that create a galvanic current with all the toxic effects, and remove the one side and spontaneously resolve that tumor. I didn't use any chelation therapy, just a homeopathic remedies, and she's been cancer-free for 8 years, and she died at age 94 years old of natural death. So modern medical and dental problems, dental treatment almost never deals with reasons why these problems exist, while they frequently create new medical problems as side effects of the treatment. We must address the underlying problems. We must think differently. I just like to remind you of this cavitation. Perfectly normal looking x-ray, even though cone beam scan. Her blood pressure was 250 over 150. When oral surgeon got inside, they actually showed us a massive cavitation showing. What about those cavitate, X-ray, 3D, CT scan, all those false positive and false negative? We have to be aware of those, how sensitive this test is. Even PET scan have a false positive for 13%, false negative for 9%. Almost 20% false reading from PET scan, which is considered gold standard. So I want you to be aware of this, our own limitations, and we may have to go into that subtle energy field. For me, I do acupuncture meridian assessment to train physicians and dentists. You can do like a muscle test, perhaps like what Dr. Tannen talks about it. And dentists may play a very important role for anti-aging. One of my patients is actually breed horse, and I told her, you need this medication. There's a parasite medication I wrote for ivermectin and parental palmoid. And so he was looking at it, he goes, wait a minute, I give this medication to my horse. So we had a long conversation, and what she told me was very interesting. In old days, the horse used to live 25 years around that time. But nowadays, horse usually can live 40 years or more. But routine deworming and routine dental care. They're almost doubling the lifespan. So trying to convince my anti-aging group, maybe there's a new way of doing anti-aging. Maybe we need a dentist and the deworming. But I couldn't really convince them about the whole phenomenon because they always ask me, show me the data. Where is the data? Except the horse, it doesn't count. But I think dentists play a very important role for anti-aging. It have to be done correctly. And also work with physicians who understand the whole concept of a synergistic way of treating for the mankind. So I want you to understand the concept of asymmetric threat. Donna Rumsfeld talks about known knowns, known unknowns, and unknown unknowns. The parasite, we know some degree. We know about the dental to some degree, but we don't know the degree of the problem that make it unknown. They are engaged in what I call unconventional warfare to us, to the mankind. To solve them, X-ray or blood tests or cell tests are not sensitive enough. We have to use unconventional approach. And one of the unconventional approaches to recognize them is, from my point of view, measuring the subtle energy field, the Meridian system, that has been known for over 4,000 years. We don't have to invent the wheel. It's been known for 4,000 years. How we can integrate the medicine and dentistry at the top of what I call biological holistic medicine and biological holistic dentistry. We have to be in charge of this integration of medicine and dentistry. This is from Allegory of the Long Spoon, the difference between heaven and hell. This is from Van Cathedral in Iran. It's hard to see the pictures, but what they're saying is with a long spoon, you cannot feed yourself. It's in a table. And the heaven is people figure out how to feed each other. They cannot feed themselves. When they try to feed themselves, they're starving. They can only get a few drops. So they have to learn to feed the next guy, and the other guy have to feed me. The hell is what they're trying to feeding for themselves, and they end up starving to death. That's what we call starvation and heaven and hell. So we need to learn to integrate, collaborate for creation of heaven or hell. Dentistry needs partnership with medical doctors who understand dental medical energy medicine. And from illness to wellness, the difference is I or we. I as an illness or we as a wellness. And the accidental cure dentistry is such an important part of the missing link tied together with energy medicine. And I'm going to just wrap up here. Here's my website and my book explaining the whole phenomenon about accidental cure. So that's it. Thank you very much.